everyone. My name is Christine Stubbe. I am one of the medical education specialists at Genova Diagnostics, and my specialty is GI product line. So I am a naturopathic doctor by training, and one of the things that I love about naturopathic medicine is that we always look for the root cause of a condition, and it just so happens that the gut happens to be the root cause of a lot of conditions. And so gut health is very, very important, not just because of GI tract symptoms that people might have, but for our entire system. We know that the GI tract is where we absorb our nutrition, and so we want to make sure it's working well from beginning to end. From the time we put food into our mouth until it comes out, we want to make sure that all parts of our GI tract are working properly. And so I have a special passion for everything gut related, the bugs that live there, the functions of the gut. And so in the coming weeks, as I meet with you guys on here, I am most likely going to talk about gut related topics because it's my favorite thing. And so today I just wanted to talk about gut symptoms that people have. They're very common in patients that I've seen over the years. That's what brings a lot of people into the office, is their GI tract symptoms. And so what are the ways of assessing this? How do we get people better? So one thing that I noticed a lot is that people have a diagnosis of irritable bowel syndrome, which is basically just a constellation of symptoms, whether it be abdominal discomfort, constipation, diarrhea, but that diagnosis itself doesn't really tell us what's causing those symptoms. And so once you can get to the root cause of a symptom, then you can treat it and the patient gets better. So why not? So we offer a couple of different tests in our GI testing product line. And I'm going to talk to you about one of them today called the GI-FX. It's a stool test, and the GI-FX Comprehensive assesses biomarkers in different areas. So we look at biomarkers of digestion and absorption, inflammation and immune system, and organisms. So commensal bacteria, pathogenic or potentially pathogenic bacteria, yeast, parasites. So any of those functional categories can result in symptoms, and sometimes the same symptom. So if a person has diarrhea, you don't automatically know what functional category that might be stemming from. They might have pancreatic insufficiency, causing their pancreatic enzymes to be low, and that would cause maldigestion and in most cases diarrhea. You may have inflammation in your gut, and that could lead to diarrhea. You might have a parasite or a potentially pathogenic bacteria. So the benefit of comprehensive stool testing is that you get to cast a wide net, and then from there you can treat according to what the findings were. In some cases, there are findings on the GI-FX stool test that might lead you to do additional further testing. It's kind of a clue that something else might be going on. So again, it's kind of a nice test to start with because it gives you answers and helps you get closer to finding out what the root cause of the patient's symptoms were. So an example of that would be, we have a lot of biomarkers on the stool test that might give insight into the fact that the person has a condition called small intestine bacterial overgrowth, or SIBO. And we have a SIBO breath test to assess that. If the particular markers on the GI-FX stool test hint at SIBO or even intestinal methanogen overgrowth, they're not necessarily diagnostic for those conditions. You'd still have to do the breath test, but it might point you in that direction. And so the GIFX is a great starting test, and that's a frequently asked question that we get on the phone a lot at Genova is, I have this patient with these symptoms, where do I start? Well, the comprehensive test is nice because, like I said, you're casting a wide net. You're getting a lot of information. You're getting a lot of answers back. And if there are findings on that test, great. You start there and you start working with the patient for treatment. If the findings direct you otherwise to maybe do food antibody testing or SIBO breath testing or intestinal permeability testing, that would be another step. And that's something I'd like to talk to you guys about in the future. I'm not going to go on for too long today. I really just wanted to introduce myself and let you guys know that we will be doing these live broadcasts both on Facebook and on Instagram pretty much daily. And you'll get to meet all the members of the medical education team, so we're excited to introduce ourselves. And if you have any questions, you can always email us, info@gdx.net. You can visit our website, www.gdx.net. You can call us, 800-522-4762. If you have an account or you want to set up an account, you can go through any of those avenues. The other thing I wanted to mention is that we realize a lot of people are staying at home right now because we're told to, for our safety and for our health. And so you might be wondering, okay, well, how do I get these kits if I do want to do these tests that I mentioned today? Well, we do drop shipping directly to the patient's house. And so we've streamlined our online process for ordering and being able to drop ship. And these tests, particularly the ones that I mentioned today, the stool test and the SIBO breath test, can be done at home. And so just wanted to pass that message along that you guys can stay safe and collect from home. And I'll be checking in with you again next week. Thanks for watching. Bye, guys.